The private health sector is a good source for employing more health workers, but I don't see it working in HIV very often.
The private sector's willingness to support the HIV response depends on the regulatory environment, financial incentives, and providers' perceptions of their role.
Governments and donors have an important part to play in making room for the private sector. A recent study in South Africa and India found 4 main action steps they can take.
First, the private sector won't offer HIV services unless providers see a market opportunity, like high demand or low barriers to entry.
For example, in India, HIV services are free in the public sector. But there's a shortage of health workers, which causes a strain on the health system. If subsidies were targeted to only those in need, the private sector could focus on patients with the ability to pay.
In South Africa, the private sector is engaged in the HIV response. Policies like tax breaks incentivized it to enter the market.
Giving private providers access to the resources they need, like ARVs and loans, helps too.
And as demand increases, the private sector will hire and retain more health workers.
The second step is to engage the full range of the private sector for HIV service delivery.
In India, the Asian Health Alliance is increasing access to HIV laboratory tests in rural areas through contracting its services to both the public sector and private doctors.
And in South Africa, CHAPS is innovating to find young men for HIV outreach and circumcision.
The third step is to be judicious about regulation.
How so?
The right regulations can promote innovative and flexible business practices and assure quality. In India, regulations allow the use of mobile medical units.
But ineffective and burdensome regulations may discourage private sector growth.
The final step is to determine how to pay the private sector.
In India, many clients pay directly for services. So we have used efficient staffing strategies and technology to make care affordable.
And in South Africa, we've used public-private contracts to allow private health workers to provide specialized care. The private sector will also be included in the National Health Insurance Scheme.
It seems like donors and government should think about whether they're encouraging private providers to scale up HIV service delivery or crowding them out.
You've got it. The private sector is here to help, but only if we let it.